Hello and welcome to Simply Nitin, my weekly show that tries to simplify complicated matters. In this week's edition, I'm going to talk about what else but coronavirus and its effect on the Indian subcontinent. India, in keeping with its recent policy and approach, has decided to take a lead in coordinating different efforts to mitigate the effects of coronavirus on the Indian subcontinent, India's immediate neighbourhood, and its extended neighbourhood. Prime Minister Modi, in a early morning tweet on Friday, decided to, in a way, revive the SAARC initiative by saying, let's join hands, let's put all our best practices together and see how we can fight this global menace or the pandemic that has been declared by the World Health Organization. And all the other leaders, almost all leaders in the region, from Maldives, from Bhutan, from Sri Lanka, and from Nepal, have immediately responded to Prime Minister Modi's appeal and to his initiative to join hands in fighting the menace of coronavirus. India, of course, has helped neighboring countries in what is called the humanitarian assistance and disaster relief when natural calamities have struck these countries. But this is perhaps for the first time in recent memory that India is also taking the initiative in putting together an effort to combat the after effects of coronavirus on such a large population that inhabits the South Asian region. So what is India going to do? To start with, India has already sent a composite large medical team along with medical supplies to the small island nation of Maldives, because India thinks and Maldives believes that unless preventive measures are taken, that small country in the Indian Ocean is very vulnerable. So that team is going there and the supplies are being taken there despite the recent ban on essential medical supplies to be exported anywhere else out of India. That is one of the first steps. India has also helped Iran in a way after evacuating two batches of pilgrims, Indian pilgrims from Iran. First batch, as perhaps all of you know, is now quarantined at Hindon Air Base near Delhi. And the second batch, which came in on Friday, is now housed and quarantined at a naval facility in Mumbai at Ghatkopar. But that is not all that India has done for Iran. India has in fact donated the entire laboratory, the medical lab that tested all these pilgrims before they were brought back. While it was set up in Iran, India has donated that entire lab to Iran, so that Iran, which is perhaps the second most or the third most affected country after China and Italy, can combat the after effects or the effects of coronavirus. India is also looking at mobilizing its military facilities wherever possible, and in that respect, the Indian Army has set up quarantine and isolation facilities at as diverse locations as Jaisalmer, Chennai, Kolkata, Secunderabad, Suratgarh, and of course something outside Delhi, which has been set up by the ITBP, the Indo-Tibetan Border Police at Manesar. The Indian Navy has set up, as I mentioned, this quarantine facility in Mumbai at Ghatkopar. Its facility at Kochi is also up and running for any eventuality in southern India, especially in Kerala. And INSH, that is the INS hospital, the Indian Naval Ship Hospital called Ashwini, in the heart of South Bombay, is also now one of the designated centers for evacuating or isolating civilian population in the western region of India. So clearly, India is taking steps to prevent or sort of isolate any patients with symptoms of coronavirus or COVID-19 as it is called in the popular parlance. Notwithstanding all these efforts, India has also set up excellent facilities at the airports which are vulnerable in the sense that people coming back from Europe or maybe even from other countries like the US or Iran or any other country in the Gulf have to be screened. And going by the experience narrated by a number of people who have arrived at Delhi International Airport or other airports in the country, other international airports in the country, the facilities are excellent, the steps are very deliberate and also done very scientifically. And of course, as his is wont, Prime Minister Modi has tweeted, has now decided to also have a big publicity campaign. Film star, mega star Amitabh Bachchan has now joined the effort by tweeting or by releasing a video. Specialist doctors from the All India Institute of Medical Sciences have done short video interviews which are going around to educate people and bust some of the myths that are associated with the efforts to combat COVID-19. And more importantly, maybe irritating for some of us, but India's Department of Telecom has installed a pre-recorded message on every mobile phone. So while all of us make a call from our mobiles, there's a message that comes up which gives out what needs to be avoided and what needs to be done. Basically, do's and don'ts for combating coronavirus. So clearly, India has, despite its slow start as some people feel, has got its act together and taking perhaps some lessons from what went wrong in the UK or is going wrong in the US, and of course what went wrong in China in the couple of weeks at the initial stage of the spread of the virus. India has really put facilities that will take care of many of these problems that people face. The biggest issue, of course, here is to combat myths and also prevent panic amongst the people. Delhi government, as you know, has closed down schools, colleges, has closed down cinema halls. Others are following in Haryana perhaps, and maybe other states will also follow. The IPL, in the Indian Premier League, the very prestigious and very lucrative cricket league, has also been postponed by almost a month. And so clearly, India is locking itself down because given its population, it does not want to be victim of a pandemic, which WHO thinks will take some time to dampen down. Maybe rising temperatures as the summer approaches in the coming months will help a bit in preventing the spread of the virus or the disease. But India needs to continue and sustain the efforts that look like very well coordinated by the Health Ministry, by the Prime Minister's office, by the armed forces, the Central Armed Police Forces, and of course the excellent set of health workers that India has. How this will pan out, whether this number of people affected by coronavirus in India will go up substantially or India will be able to manage the spread will have to be sort of looked at after a couple of weeks. But clearly, as a big country, as a big democracy, as a leader in the region, India has taken the lead, and that's something that all other countries in this region are thankful for. That's something that one must commend this government for. But what happens maybe 2 weeks down the line, we'll have to wait and watch. Until then, it's goodbye from me, Nitin Gokhale.